At AV&R, our mission is to humanize robotics. We decided to create this podcast series to help you demystify the world of robotics and discover what some of the brightest minds in the field are doing. Welcome to Robotics for All Podcasts by AV&R.
We are excited to welcome Mathias Unberath, CTO and co-founder of Semaphore Surgical and associate professor at Johns Hopkins. Mathias is at the forefront of surgical AI, turning cutting-edge research into computer vision, perception, and simulation into real-world clinical infrastructure. He joins us at a pivotal moment in healthcare, where surgical robotics is already transforming procedures, and the next leap is intelligence. Imagine Tesla autopilot, but for surgeons with fewer potholes and much higher stakes. This conversation goes beyond technology and dives into what it takes to bring AI safely into the operating room. If you're curious about where surgical robotics are headed, how trust, regulation, and collaboration shape the future of automation in healthcare, this episode is for you. You will hear us cover big themes shaping the field: improving patient outcomes, scaling access to care, the shift from hardware to intelligent systems, and what it really means to build trust in AI-driven surgery. We even paused to imagine a future where these robots unlock self-care at home, in the same way 3D printing has brought manufacturing into our homes. Hope everyone enjoys the show. Here we go. Hi, Mathias. Thank you for joining me today. Really excited to have this conversation with you.
Oh, thank you for having me. This is fantastic.
Yeah. So you're working on a startup. We're not going to say the name of the startup just yet, but you're in an exciting space. And so, I'm going to let you start things off. Tell us what you're working on and what you're looking to launch.
So we founded together with two close colleagues of mine, a surgeon, Tito Porras, and a roboticist, Axel Krieger. We founded a startup in the AI and autonomy space for medical procedures, spanning all the way from interventional interventions all the way to surgical procedures, where robotics are now really driving change in how we deliver care.
Okay, very exciting. Maybe take a step back. I've had a couple opportunities in the past to talk with folks in the surgical space as well, but I have a vision, like being on the operating table with a bunch of robots taking me apart. Maybe it makes me nervous, maybe it makes me feel good, but let's talk about, for people less familiar with surgical robots and AI, what are we talking about today? What is the state of the art, and what do you hope to accomplish with this?
Yeah, certainly. I think it's easy to have a perception of surgical robotics and AI that feels very science fiction, which I think is not at all true if we look at from a boots on the ground perspective. I think there is lots of excitement to be had around surgical robotics because it really drives improvements in patient outcomes for the procedures where we see it widely adopted. I think it's important to realize, which is maybe not for people who don't think about surgical robotics every day, to think that it's something that is a one-off. So if you need surgery, then it's very unlikely that it will be a robot. But I think that becomes increasingly not true, depending on the surgery that is being delivered. So we see for hip and joint implants, we see a lot of robotic systems being used for procedures like prostatectomy and hysterectomy. We see close to 95% of procedures being delivered with surgical robots. And so they are being used in surgery much more frequently now, perhaps much more frequently than people would envision them being used. And in many of these cases, there is truly something positive to be said about patients actually wanting to be treated in a robotically mediated way, because usually it reduces complication rates, it allows for smaller incisions, which is associated with less complications afterwards, so patients heal faster, all of which are good things. Now, at the moment, you mentioned not just surgical robotics, so this is the surgical robotics side. The AI side, I think, is much less advanced at the moment in time, and this is something where I think the future will have a lot to bring for us to consider on how we can make robotic surgery even better for the patients.
Yeah, yeah. Well, and yeah, when I listen to some of the podcasts I like today, or there's a lot of talk about AI having a bad name right now. So we're going through that science fiction moment, I think, with some of the technology. And when you see what's happening in the world and some of the different wars being fought and how they're being fought, and so it's easy to focus on the negative. But I'll tell you, so I drive a Tesla, and every now and then I enable the self-driving, the autonomous driving, and my wife and I would always try and make predictions. When will it be here, right? Self-driving. She's in the technical field as well, and we thought it was a long way away. And I have to say, it's really good right now, and the car is safer with it. So I can imagine in a field like surgery, with the right implementation, it will be safer. Not only do you have like an experienced surgeon potentially in the loop guiding things and how they happen, but you have all these sensors and intelligence overlooking everything that the surgeon might miss and helping with that. So I think, yeah, once you get quickly past that science fiction mindset, the benefits of it are quite obvious.
Yeah, thank you, Michael, for bringing up that car analogy. I think it is perhaps the one that jumps to people's minds the most quickly, because it's technology that we're all familiar with, using cars
right now.
In everyday life. But I think there is an important part to your story that you haven't quite shown a light on as much, which is that full self-driving didn't roll around the corner yesterday, going from 0 to 100 within a day or two. It is a much longer process that the car industry has been going through, where we started with much simpler features like lane recognition, traffic sign recognition in order to give warnings around the speed limits, moved on to slightly more actually assistive features that don't just provide information, but actually intervene in the drivetrain by assistive braking, or truly the lane assist feature, all the way to now where we are at full self-driving, as well as the rollout of automated rideshare services like Waymo in the Bay Area. And there is a very interesting article that a New York Times editorial that came out late 2025, which very quickly ended up being one of the most read pieces, that positioned the implementation of self-driving as one of the most important public health interventions of the recent decades, because of how dramatically it changes the safety of personal vehicle travel, just because of exactly what you said, is that if you ask people, everybody will tell you that they are an above average driver, which basic math will tell you it doesn't work that way. And the same, of course, holds true in surgery, where I don't want to qualify any specific surgeon, because they're working really very hard. But surgery is difficult. It's a very difficult skill to master, very different from driving a car. Everybody can learn to drive a car. Not everybody can learn to perform surgery at that specific level. And these types of features that we're talking about, AI thought about this in a crawl, walk, run approach, similar to how we have seen rollout in autonomous driving, where we start with, we can call it ambient intelligence. So systems that sit and watch and maybe give off a warning if something doesn't go the right way. Next step, something that helps with assistive features, all the way to where we can potentially perform very complicated things autonomously, is all there as an additional safety layer to help standardize the quality of care and make more consistent the patient outcomes that we all like to see, the great ones.
Sure. So I have a in my family, I have a cousin that is a spinal surgeon, and so I think that it's obvious the talent is there, but when he was operating and running his practice in Canada, because of our healthcare system, for him to get operating time, often he was operating at night. So he would be in the OR. He'd be maybe do a clinic in the day and OR at nighttime. And often these surgeries were 5-8 hours long. And here you have a super talented guy that's working extra hours and off shift. So I think that for a guy like him, the talent is not a question, but staying focused and being alert and executing to your best of your abilities, it's amazing what they do. It really is.
Absolutely, and they are certainly asked to do a lot, because it is not just the surgery that is happening, it is also the documentation after, it is the clinic, it is the actual procedure performance, and then you have to be there scrubbed in while certain tasks are being performed that don't necessarily require the level of training that like the fully trained, fellowship trained surgeons actually bring to the table. And there's a question about how to think about changes in the system so that we can deliver better care more consistently, and also offer it more broadly to more people, simply because already today, if somebody needs surgery for something that is a little bit out of the norm, very likely they're being faced with wait times of multiple months, perhaps longer, which sometimes results in these people not actually receiving the care that they would need, simply because the system has backlog. So there are lots of opportunities that are both in the direction of increasing excellence, making sure that patient outcomes are more consistent, more repeatable, as well as in the equity and access direction in which this technology can help.
Yeah. What would you say is the biggest driver of change right now in the field? What makes, for end user that, so we have a couple end users, I guess. You have the patients, right? But then you also have the hospitals and the doctors. So obviously, as a patient, that's where I would fit in, the opportunity of potentially having a safer surgery, better outcome, and all that stuff. That's important to me. I guess the difference between Canada and the US, there's some like administrative differences, like between the healthcare system that is reliant on insurance, for determining level of care, and then our system where we're theoretically everybody has equal access, but you got to wait in line for your access. What's the main driver of change right now in terms of end customer?
I think there are a lot of different entities who are looking at the challenges from different perspectives, and I think those are the manufacturers. There is the healthcare systems, there is the patients, and then there are the surgeons, all of whom have a slightly different perspective on why the integration of AI and automation capabilities may be beneficial. I think, broadly speaking, the two buckets are the ones that I briefly mentioned earlier, which is the idea of excellence and improved patient outcomes. The other bucket is the one on equity and increased access. And equity and increased access has an economic flair to it as well, because it usually means that we can perform more surgery, and that might be important for certain people in that space as well. When we're thinking about the excellence side, I think it's really standardizing patient outcomes, making sure that whenever a surgeon has a bad day, which can happen, there are people like everybody else, it doesn't result in the patient having a catastrophic one. So being able to catch certain adverse events that happen due to fatigue, due to simply being a very complicated case where something might be missed because the visualization conditions are very tricky in that specific anatomy, for example, because it is inflamed, and having that additional layer of safety to really drive patient outcomes is really important. The additional benefit, of course, is that we can introduce different robotic form factors that truly allow us to deliver care in a different way. So much smaller access, smaller incisions, all of this. So this is the excellence bucket that really matters. And the one that patients, I think, are ultimately the most invested in, because it can change how their care is being delivered and how fast they recover after surgery. The other big bucket is this access and equity bucket, where I think it is perhaps obvious that we need to be able to offer more healthcare to people. Part of it is demographic change. Part of it is that the whole field and science is pushing the boundaries of how we can treat certain conditions, what conditions we can treat. And so as we unlock these new treatments that would enable us to expand the health span of people and a society in general, we need to find ways of offering these types of treatments. But at the same time, we have a healthcare system that is incredibly strained. People already are working too many hours, they're tired, so we cannot simply ask them to perform more procedures. There needs to be some transformation in the system that allows us to care for more people and provide more care, so that we unlock these new treatments, these new procedures, and unlock the same standard of care for everybody in the US, and then ideally globally.
Yeah, yeah. That's a good reminder, because, it's easy to complain, right? That, the healthcare system's overwhelmed, and, we're not getting access. And one of the good reasons is there is more treatments, right? So it's not that people are necessarily getting sicker, but we're able to treat more and different things, which creates more volume through that system. So that's an optimistic reason that our systems are overwhelmed in that sense, and a good reminder about that science is progressing and helping us live longer.
Absolutely, and it will be even more transformative if we figure out how do we actually deliver to everybody who might qualify to receive the treatment.
How many things are we not doing that it's simply because of capacity, right? So they get swept under the carpet, where we could be helping more people out. So, okay, here we are now. You're about to launch a company. When I had the chance to talk with someone in the field before, that their reason to launch into the industry, and this is going back a few years, was something called haptics. So it was really a hardware thing, right? And the haptics gave the feedback, and we experience haptics every day right now, like in our cell phones, and the vibration that we get from a notification happening. So they saw the potential back 8-10 years ago, whatever it was, of that technology giving a teleoperated robot the sense of touch to a surgeon guiding it, right? Fast forward, here we are today in 2026. What is this moment? Why is this moment special right now for robotics in surgical environments?
There are multiple factors, I think, that at the moment really creates a very interesting mix that brings forward this type of technology. On the one hand, we have the hardware platforms that for general surgery and general interventions, that the hardware is maturing. So we see a certain convergence in what these robotic systems look like, what their form factors are, how they interact with tissue, what types of procedures they can do. So there is a level of convergence in that hardware space, with multiple more companies building systems that all are, of course, differentiated, and they have their individual best aspects, but they are relatively similar in what they can do and how they deliver the care. What's interesting about this is that we now understand this physical form factor really well. That shifts the focus of development into the intelligent realm of how do we now equip these systems with the next level of perception capabilities, of reasoning capabilities, of understanding capabilities, in order to solve these challenges that we chatted about earlier, about AI capabilities to make sure that we spot adverse events before they happen, that we can support the surgeons in order to deliver the best possible care, in order to automate certain capabilities to make sure that the outcomes are repeatable and consistent. So this is this one transformation, the shift towards intelligence as a key differentiator in products and in how we deliver care. The second aspect, of course, is that over the last now close to 15 years, we've seen this unprecedented growth in the machine learning, AI, and machine vision capabilities that really have provided opportunities to solve some of the most challenging problems in this space for machine perception and then also control. So both within the founding team of the startup, Axel Krieger particularly has recently shown that we are now at a point where we can, with these AI algorithms, solve some of the most challenging subtasks of soft tissue procedures in autonomous clipping and cutting of gallbladder surgery. That with this technology, we can now truly think about solving or addressing some of the challenges that we have in these incredibly complicated soft tissue surgeries. So the ability to have this avenue of, yes, there now is clear methodological potential to solve some of these previously thought incredibly hard and unsolvable challenges, to start tackling them, is creating another upward momentum.
Yeah, okay. Yeah, so you purposely focused on the software platform. Directionally speaking, you see the hardware becoming a little more commoditized and more common. Is there a push amongst these companies manufacturing the hardware to standardize the way you can communicate to them? Like if you're looking at the different platforms and you want to add value to someone else's hardware platform, is there a push towards commonality in the medical industry? In the industrial robotic space, there isn't, and that's one of the challenges of folks like ourselves. Is what color is the robot that goes in your machine, and you have to, if the customer says, okay, I want a different brand, you got to redo all that effort that you potentially put in. How are you managing that across platforms?
It's a very good question, and I think that at the moment there might be certain aspects that see standardization, and there are efforts in the industry that are trying to create standards around data and system interfaces.
Yeah,
I think that overall the industry is not quite at that point yet, where these standards have become one of the major pain points. In part, that is because the health tech and med tech industry historically has been quite hesitant in adopting other technology. There are examples on where a single supplier supplies many different med tech companies, and that has worked quite successfully. But when it comes to these build internally versus buy externally decisions, historically speaking, it was more of a build internally decision, just because it enables differentiation. One doesn't have to surface certain trade secrets and decisions like that. AI, I think, is changing to a large extent on how some of these players in that field, the leaders in the medtech device industry, how they have to think about this. Because on the one hand, the current pace in AI development has been incredibly fast. And while some of these big leaders in this space can potentially build all of the AI capabilities in-house, the timeline with which they might be able to unlock those AI capabilities may not be sufficiently fast to stay competitive when you look at some of the competitors that come out from the startup space that don't yet have these rigorous processes that innovate at a slightly faster pace. On the other hand, there are other considerations to be had, because the biggest issue usually that you will face are repeatable motions around data, around how to process data, how to unlock data for AI developments that then feed into the models, that then feed into the AI capabilities. At the moment, there is a lot of challenges, even at the very front layer on the inputs into these AI models. Not when it comes to demos, because if we demo something, we can very quickly do this. But if we're trying to build out AI products for true healthcare delivery in a regulated space, the demands on the data fabric, the demands on the models and everything that goes into that corresponding product are significantly higher. And being able to do this repetitively and at a very high speed is incredibly challenging.
Yeah, I can imagine. Yeah, so to share an analogy with what we're into, because we're in aerospace. So we had one of our product offerings was visual surface inspection, right? And so there's a lot of critical parts within the engine of a aircraft, and so when all this AI, we've always used AI and machine learning. So as it evolved, let's say it that way, we started looking at some of the larger models. And when we would have good results in the demo effect that you're talking about. And then when we would present it to customers, they'd be like, okay, this is interesting. Now, can you explain how it makes these decisions? Because if you're going to use AI in inspection, automated inspection at the end of line to say, yes, this component is good, and it looks like the last component you saw, they have to be able to explain it, why they approve that system into their production, right? Because it's going to be the last thing that sees that part before it goes out the door. And one of the challenges we have is, so we had a partnership with a customer, and then they turned around and it's in a regulated body. So they went to the FAA and said, okay, we'd like to use AI for inspection, and we'd like to show you what we're doing and get your approval. And they looked at their priority list and they said, well, not till 2035, right? So there's a few challenges to that sequence, right? For a company coming and trying to make a commercially viable product. And so I imagine like healthcare, you as a company, you would have to know those processes very well and how you bring that AI to market, how you prove it out. And that could be a strategic advantage for you, just like you're saying.
Absolutely. There are several challenges to innovating at AI pace in a regulated sector. And this is certainly one of them. On the one hand, I think, given that Axel and I have a rich history of innovating in this space, we have rich connections to the right leaders also in the regulatory bodies, where we understand some of their thinking. They understand our body of research and where the field might be going, and this influences how they're thinking about regulatory. And we engage them early to have discussions to really understand how they are currently thinking about where the whole AI and automation space may be going, what the most important considerations are, because that allows us to plan ahead and make informed decisions on what is a likely successful path and what might not be acceptable from the perspective of the regulatory body. At the same time, while we do see now some successes in the regulatory space where there are cleared products that bring first autonomy features to market, there are still many questions that are absolutely unanswered of how AI and automation should be rolled out, especially in soft tissue surgery, where creating accurate models of what will happen as the surgery progresses is incredibly complicated.
Yeah, I can see that. So there are a lot of moving parts and a lot of changes happening. As a founder, how do you navigate these waters, right? So you're obviously the path to success and launching your company, and with so much change and uncertainty, how do you approach this as a founder and set your company up for success?
There are multiple parts to how we are thinking about this space. The one is that we strongly believe that in order to be successful in the healthcare and in the surgical space, performance alone is not going to get us there. It's a necessary but insufficient requirement. The other one is trust, and this trust is built with all stakeholders across the board: the patients, the surgeons, the surgeon societies, the medtech leaders and companies that are building their products and choosing to work with us to incorporate the technology, as well as the regulatory bodies that ultimately have to sign off on all of these features in order to ensure patient safety. And this really doesn't lend itself to some of the current disruption mindsets that we have seen in the AI space. It's really more about measured progress that allows us to advance this field slowly but surely, making sure that patient safety is guaranteed. I think the other aspect is the one that I mentioned earlier, which is that while, of course, our ambition is to demonstrate AI and autonomy for procedural medicine towards automated surgery, because we believe that technological advancement is necessary to unlock some of the benefits, both in excellence and in equity and access. The path there is not 100 to 0 tomorrow. It is slow. It is slow, it is measured, and it allows us to build trust and gain experience with this technology in an incredibly safety-critical domain. So starting with these ambient AI features that, like just a quick look over your shoulder, the way that a resident or a fellow might already be used to doing it, where the attending is just also standing there, just make sure it's like, oh, don't you think that perhaps you should be doing it slightly differently, as a free way of getting an additional, opinion as you perform the surgery immediately, and then progressing towards these quote unquote lane assist features in surgery to ensure safety. And all of this allows us to, over time, familiarize ourselves, or those people who interact with it on a day-to-day basis, or have some agency in approving it or using it, make purchase decisions, to really familiarize themselves with what this technology can do, how it changes for the better the fabric of how we deliver care, and then ultimately build more optimism towards advanced features like full self-driving. I don't think that you would have turned that on even 10 years ago, right? Like, it's been
that's a good question.
It's a subsequent exposure where you slowly but surely understand this technology on a technological level, where there is a certain level of trust that is being built over time, making you more comfortable with the use of this type of technology. And I think a very similar approach is necessary in surgery as well.
Yeah, it's a good question. Would have I turned it on 10 years ago? And I think I'm kind of not that I'm unique with it, like I have a unique viewpoint because I'm in robotics, right? So, and I built like a mobile robot in my house, and I serve my kids chips with it, right? So that's the geek in me. So when I looked at a self-driving car, I'm like, oh, okay, I kind of see what they're going for here. But what blew me away is like, how do you put all the rules around it? And, like I had trouble when someone pulled out a chair. I'm like, man, you're going to mess up my robot path, So how does a car deal with everyone and all the different pedestrians and the storm that came in and stuff like that? That's the amazing part in my mind. But I think I would have turned it on back then, but I wouldn't have closed my eyes.
I am right there with you. Being a technology enthusiast, I would have turned it on pretty much out of the box also, but perhaps on a Sunday in an empty IKEA parking lot, not in downtown Baltimore.
For sure. Now, okay, you talked a lot about a lot of factors, right, that are making things slow. Like, we've got the institutions, we've got the cultural shift, the patients and how they feel about it. So if I spin the question and I force you to pick one thing, what do you think's really going to pull this through? Is it going to be, I think about ChatGPT and the different AIs now. My parents are older, and we, sometimes we get some health scares. And the first thing that my brothers and I do is we go to ChatGPT and we check out what's going on, and what's the advice and what questions should we ask when we go to the doctor, right? So do you think, who do you think which one of those characters will be the one that will really pull this over the finish line and make it an important element, robotic surgery and AI and robotic surgery?
So if you force me to pick
one
single entity, then after 10 to 15 seconds of deliberation, I think I would pick the surgeons. And the reason why I would pick the surgeons is because secretly, while picking surgeons, I get to pick two.
Okay.
Because surgeons care very deeply for their patients. And as a consequence, I get to pick both of these, the surgeons and the patients, because surgeons really care about making sure that they serve their patients and that they deliver the best possible outcomes. And so when you are at these surgeon congresses and you hear them talk about what they truly care about, it is all about doing better for the patients that they treat, as well as allowing them to treat more patients because they know that they need it, and they really want to move the needle forward and are therefore quite technology optimistic when it comes to all of these types of advancements. Just last week, we were speaking at the ARISE Congress for endovascular neurosurgery and stroke treatment, where now one of the biggest shifts is indeed in endovascular robotics for treatment of stroke in the emergency cases. And pretty much everybody in that audience is incredibly excited about this advent of endovascular robotics, because they might be able to treat stroke patients, despite the fact that at the center or at the location where the stroke happened, there might not be a corresponding neurointerventionalist available to actually perform the procedure. But because a robot might be there, you can call an expert in from one of the coasts or from one of the hubs and perform life-saving surgery for that specific patient. And so they really embrace the technology because it can truly help perform better, like deliver better care for the patients.
Yeah.
It also just lifts the stakes, because if the surgeon doesn't believe that they offer better care with this type of technology, then what are we developing really? So it is truly to develop technology that cannot just automate something because it can, but it serves a clear need that helps us move the needle in interventional and surgical care, either in order to increase equity and access or in order to increase excellence. Both of these are incredibly important, and surgeons are great advocates for that.
Yeah. Yeah. And, when I think about my cousin, he loves technology. And so I could definitely, he's talked about surgical robots many times and had grants to investigate it. And I have to say, it's a really humble answer. Some startup founders would say it's their company that will pull this into mainstream. So, and that's a sign that you're, really open to collaboration, because I really see that this is not a one company does everything topic, right? So, with a highly regulated industry, many stakeholders, I can see collaboration playing an important role in what you're doing. And is there a good platform for collaboration inside the space, or is this something you've had to create?
As you say, I think collaboration is at the very heart of everything that we do. And internally, our founders are somebody in computer vision and machine learning, which is me, a roboticist who has a mechanical engineering background, who is Axel, and a surgeon, Tito. So already at the very core, we're thinking deeply about a collaborative approach and multidisciplinary viewpoints onto the same problem. Because if you only bring a hammer, every problem will be a nail. And especially in the field like medicine and surgery, I can guarantee you there are many other devices, not just nails. And ideally, you bring both different a diverse toolbox, but also an open mind to understand how to best solve these problems. But this is just internally. Externally, exactly as you say, it continues in part because we are choosing a software-first company because that is where our core expertise lies and where we believe that we can serve the space the best by helping, with this horizontal infrastructure for AI development, all the way from the data fabric to shipping deployment with regulatory artifacts. We have to partner with institutions and leaders in this space to bring that capability and that innovation to the patients. And that are the medtech companies who are building the fantastic hardware platforms that we would be interacting with. These are the health systems that have to adopt the technology eventually, as well as the surgeons, and then all the way to regulatory bodies. But as you said earlier, I think it doesn't stop there, because the perception of robotics, the perception of AI, the perception of autonomy in society may not always be the best. And so we also have to work collaboratively in that direction to try and educate the public on why this technology is desirable, what potential opportunities are, what risks are, and how they can be mitigated in order to truly drive, transformation of healthcare for the better, to result in better patient outcomes, increased access, higher excellence. And this is something that being a spin out of university, this is something that, of course, is close to our heart, because not only are we scientists, we're educators as well.
Yeah. Maybe just let's talk on that a little bit. What does success actually look like for surgical AI? What, let's take the perspective of, a patient, and let's fast forward, 5 years, let's say, or 10 years, whatever you think the right time frame is. Paint the picture of what success looks like and what you hope to create.
It's a beautiful vision to have, and I will lead by saying that in order to unlock the vision and this picture that one can very easily paint for 5 to 10 years out, this will require innovation and adaptation and change and from many different stakeholders and players in this space. Not just us and not just the development of technology, because there's a lot of policy, socio-technical system work, and other things that have to go into this transformation. But on a whole, of course, what success looks like is that it doesn't matter where the patient requires care. Their location and where they receive surgery no longer determines outcome, because there are these automated systems and solutions in place to ensure that the same quality of care can be delivered everywhere, that they have access to the best possible care, especially in case of emergency. If it's elective surgery, people today can travel. If it's an emergency, much harder to do. So being able to receive the best possible care, irrespective of where that care is needed, that is one of the success metrics that I think are really aspirational. And another one truly is just making sure that we can provide that same care consistently and safely, again and again and again. Where, as I mentioned earlier, a surgeon having a bad day doesn't mean that the patient will have a catastrophic one. And overall, I think this technology will contribute a part in making sure that we can advance the excellence and repeatability, consistency of care that is delivered, while also ensuring that everybody who needs care has access to it. So this is what on a system level success looks like.
Do you think, and this is maybe a crazy question, but we have 3D printers in our house. Do you think one day we'll have in-house care?
Well, I was thinking about how to best respond to this, because to some degree you already do. You can call you can call a virtual urgent care center, and the care will come to you. And depending on what you need, they might even prescribe and then ship the medication on a few-day delivery. Now, you can think about taking this to the next level, where instead of actually waiting for an actual healthcare provider, there may be a different type of interface to describe symptoms and do things like that, and moving point of care testing to devices that you may already have in your lab at your home. So, for example, using the smartphone and its camera for providing point of care testing where you are, instead of asking you to come to the office side, and things like this are happening. But I think it's also very important to understand that a complete technologization of healthcare is perhaps not desirable, because when people are sick and don't feel well, part of it is just that feeling of not feeling well, and that requires perhaps medication. But there is an emotional aspect to all of that care that physicians deliver as well. And I think that I think I strongly believe that taking all of that human aspect and that human touch out of the loop of healthcare is really not a desirable system.
Yeah. No, that's fair. Yeah. Okay, so again, let's maybe take a step back here, and you're obviously, there's a lot of learning going on, a lot of collaboration. What can other sectors learn from how healthcare approaches automation, right? So I think automation, there was I guess we're flipping the coin here, because the automation has been happening in many different sectors. Now that it's happening in healthcare, is there lessons that you think would be important to bring back or to bring into other areas?
One of the big differentiators, I think, in healthcare is that trust and safety is at the absolute forefront of what you think about. So technological prowess and being able to be the fastest is not the only important thing, but the trust and the assurance of the systems that are being built is perhaps even more important. This is something that I think, in the general AI sense, we have the recent boom of AI capabilities and AI technology has very strongly favored technological advancement and blazing fast pace that admittedly has resulted in great accomplishments and great technology that I myself use on the daily. But it has not just created the technology, it has also created a whole lot of question marks in people's minds about what is currently happening in society, how it's transforming certain jobs, how it is affecting each and every one, the job market and everything else. Where I think that these other aspects, which is trust and the human connection, perhaps has been sacrificed a little bit in favor of dramatically fast progress. It's hard to judge which of these two approaches is right. I can certainly say that for healthcare, the more measured approach seems to be the right way to go, simply because, as I said, disrupting the healthcare system might sound great until one finds oneself on the other side and wants to make sure that the care that one is being given is certainly the one that will help one feel better and heal. And so this is, I think, clearly an important consideration that we might be able to impart on other fields that are innovating in that same space.
Yeah, it's almost like there's a cleanup to do, right? So going blazing fast has created an amazing technology and one that we're learning about. Then a methodological, I'm not even saying that correctly, but like a rigorous approach, if I can use a different word, to go back and say, okay, now how do we apply this correctly, and how do we use it effectively so that it does certain things the way we want it to do, not just doing new things all the time necessarily.
And sometimes the effects of introducing new technology are incredibly hard to foresee simply because the systems in which they are being released may not be fully predictable. I think that we've seen this before when we talk about things like the iPhone moment, where the introduction of a new telephone that turns out to have a bigger screen, and for that bigger screen more compute, ends up changing how we think about interaction with compute and the availability of apps at our fingertips literally all the time. And so this transformation, where suddenly we do most of our things on a smartphone and not on a computer, it was not necessarily predictable at the time that the technology was resolved. And this creates a lot of challenges, of course, for healthcare as well, because you just don't know. It really just means that going fast is not the only important thing. We have to think about how the different stakeholders will interact and what might happen, not because we can perfectly predict, but so that we are prepared to think about the possible consequences and make sure that we don't accidentally harm patients, because that's just in nobody's interest.
Yeah. And you talk about trust a lot, right? And so you want to ensure the technology doesn't accidentally harm patients, right? So that's a statement where you want people to trust that you've taken care of that, and they can trust this technology. Is there anything in particular that people misunderstand or overlook when they talk about in surgical AI that maybe we haven't covered? Is there any other elements that you think that important trust word, in your when you're going out and you're talking about your company and working with you in your collaborations that you feel is important to talk about?
It's not just us alone ensuring the trust. There are regulatory bodies that we work with that really help us. And I think that I want to stress that while it is certainly true that building for safety and building for best patient outcomes, it is absolutely true that the capabilities that we now have access to with the modern AI models, the data that we can unlock either using real data, observational data, as well as using synthetic data approaches, that they, together with the modeling advances, will help us create systems that are truly unprecedented and capabilities that will help us move the needle in achieving better patient outcomes and much better patient access to this type of technology. So while I'm absolutely all for making sure that we do this safely and with the right measured approach to how we transform, it is truly an exciting time to see what this technology will help us unlock and accomplish within the next 5 to 10 years.
Yeah. It's a really, I can see a big exploratory, how far can we go? And then what are the, there's probably a number of iterations you're going to go through, but I'd be really excited to see in, let's say, a year even, because things move so quickly. Where are you guys at, right?
We have these two missions, and this is being both a scientist and now a co-founder. I think we're wearing these two hats, which is really quite exciting, because on the academic front, we get to push and define what the frontier of automated surgery and interventions is and what can be done. And then on our spin-out front, we get to actually prepare for translating that into patient outcomes and giving it into surgeons' hands, which is really quite exciting to be able to do both of those things.
Yeah, and there's two different time frames, right? So you in the business side, you want to be able to get that to market and show that progress and launch your company. So that's quite a challenge you're taking on, and you got 2 feet in 2 exciting areas. So fascinating to hear about everything. So if you let me pivot a little bit, we've almost taken up the full hour, and I know you're busy, but outside of work, let's talk about that. what do you do when you're not thinking about robots and AI? How do you disconnect and reset?
I think part of this answer is going to be maybe dissatisfying, because I have two young boys who I try to get excited about technology. So also
Okay.
outside of work, I think a bit about these robotics capabilities, not because I want them necessarily to follow my footsteps or do anything like that. Not at all. I think that with this current blazing fast pace that we've witnessed in the transformation of jobs and job descriptions, where previously we thought that we knew, we had it all figured out, right? You go into computer science, you're going to be well off. Turns out that is the least right estimate.
Yep.
My goal is just to try and expose them to certain technology that I find exciting and can present with a certain level of excitement in hopes to spark excitement and creativity and the desire to explore in them. Because I think that in an uncertain world where many things are changing, both in terms of how we educate and what it means to work and interact with technology, I think this enthusiasm for technology, a certain level of comfort with challenges and growth opportunities, and this mindset that a challenge is not it feels like a problem at first, but it's something that can be overcome if I work at it, and if I'm open-minded to see what it means and how it does, for that reason. And so I try to expose them to the things that I think I can teach with enthusiasm, because I think that hopefully unlocks something in them. So those end up being similar to what you have. I have a 3D printer here next door, and a little robot that they can program, and then things like that they sometimes enjoy more and sometimes they enjoy less. And then I try to because my job is very much in front of a desk all day. I am an avid runner and try to spend as much time as I can outdoors to get rid of some of the feelings that accumulate when you sit in meetings all day.
Do you prefer asphalt or do you prefer trails for your running?
I like both. Living in Baltimore City, close to campus at the moment, just makes me run on asphalt more than anything, really.
Yeah. Oh, that's cool. I'm a big biking enthusiast, and I've I got a couple days off this week, and so I'll end up doing probably 500 to 600 kilometers over the next 5 days. So I'm pretty excited about that. And I share your passion for outdoor and to move the body, because I don't know if you saw the evolution of man, where they were crawling and then it comes up, we became upright, and then we start becoming hunched over again. I suffer from some of that hunched over from being on my computer all the time. So it's important to get up and get the blood flowing.
No, absolutely. That's my problem as well. And as we live longer, we gotta take good care of
That's right.
of our
That's
bodies.
right. I'm with you. That's right. Well, Mathias, I really appreciate your time. It's been fascinating to hear your story, and like I said, keep in touch. Let's keep in touch, because in the future, I'd love to. When you get your company launched and the name starts getting out there, I'd love to catch up on progress and hear what you're up to and your success stories.
Thank you so much for giving me the time to speak about surgery. It's really an exciting time for this, and I'll be happy to come back and report what we've been up to.
Fantastic. Yeah, thank you.
So this concludes the episode of Robotics for All podcast by AV&R. If you don't want to miss another single episode, don't forget to subscribe to our show in your favorite podcast app. Thank you very much, everyone, and we'll talk again soon.